Alright, random and interesting pharmacy things, part 6. Propofol contains soybean oil and egg. Propofol is used a lot in the hospital for anesthesia induction and maintenance, as well as ICU sedation in hemodynamically stable patients. So patients with a stable blood pressure and heart rate, because propofol can cause some bradycardia or low heart rate and some hypotension or low blood pressure. Being a 10% lipid emulsion, it has calories, which is cool. We usually don't think about drugs providing calories. It has about 1.1 calories per mil, and then also because it's a lipid emulsion, it poses a risk for microbial growth. Another interesting about propofol is that it has antiemetic properties. Antiemetic meaning it helps prevent vomiting or emesis. It's sometimes used to help prevent or reduce the severity of post-op nausea vomiting. I'm not sure how often we use this medication for that indication. The mechanism of action is not fully understood and may involve the endocannabinoid system, GABA activity, or serotonin activity. Propofol is also the drug that killed Michael Jackson. He was also on a bunch of other stuff. Another interesting random pharmacy, or I guess like anatomy thing is we store glucose as glycogen in our muscles and our liver. We store about 100 grams in the liver and about 300 to 400 grams in the skeletal muscle. This is about like 2,000 calories because 4 calories are in 1 gram of glycogen. Also mentioned that each gram of glycogen pulls about 3 grams of water with it. Another random interesting pharmacy thing is the drugs lorazepam, oxazepam, and temazepam, what I call the lot benzos, are preferred in liver dysfunction because they really only undergo something that we call phase 2 metabolism. These are some of my notes in school from my Intro to Principles of Drug Action course. It's a 4-course series. This is one of my favorite classes and series. I took this class specifically my junior year, my 3rd year, my 6 years of pharmacy school. Phase 1 reactions generally go through the cytochrome P450 system, or the CYP enzymes. We have oxidation, deamination, NOS dealkylation, N-oxidation, desulfurization, sulfoxidation, reduction reactions, hydrolysis by esters, amides, carbamates, and carbamate esters. Phase 2 metabolism is mainly conjugation reactions. Phase 2 reactions have little or no involvement with the CYP system, so potential for fewer drug interactions. So we have glucuronidation, sulfate, glutathione, and amino acid conjugation, acetylation, methylation, and water conjugation. I will mention that although CYP enzymes aren't necessary, we need a transferase enzyme and endogenous agents to perform these reactions, or metabolism. One example of some non-CYP enzymes that can have some drug interactions are UGTs, or uridine diphosphate glucuronosyl transferases. One example is with lamotrigine and combined hormonal contraceptives. Combined hormonal contraceptives increase the clearance by UGT induction of lamictal. Random, but UGT enzymes can also be genetically polymorphic, meaning under or over functioning in patients. One example is with the chemo drug and topoisomerase 1 inhibitor irinotecan. The UGT1A1*28 allele is associated with loss of function, so we're having a buildup of this active metabolite because it's not being metabolized as quickly. This can increase myelosuppression, neutropenia, and diarrhea with irinotecan, because again, we're having a decrease in glucuronidation and clearance or elimination.